I'm Scott Harrah, Director of Digital Content at UMHS in our New York North American Administrative Office. And as part of our UMHS Alumni Achievers series, we are speaking today with Canadian UMHS grad, Dr. Shamim Shakeel Khan. Dr. Khan is a family medicine physician practicing at Dayspring Medical Centre in Bolton, Ontario, just outside of Toronto. After completing her undergrad at the University of Toronto, Mississauga, and graduating from UMHS, she completed her family medicine residency at Northeast Iowa Family Practice in Waterloo, Iowa, and then returned to Canada to work for a year at Cira Health Solutions in Mississauga, Ontario, in the Greater Toronto area. And we're here today to learn more about how UMHS helped her on her journey to becoming a doctor and returning to Canada to practice. And Dr. Khan, what about your medical education at UMHS helped to get you where you are today?
Yeah, so there was a lot of aspects of my education that helped me get where I am. First, starting off on the island, so completing the basic sciences was really key because really you can't get anywhere unless you complete the USMLE as well. And so they kind of taught me how to study. I learned how to understand what was needed to pass those exams and what they were looking for and what the style of questioning was so that I'd be well prepared for the USMLEs. Then when I was doing rotations, it was great to see several different hospitals across the US and Canada because it gave me insight and experience into, and then in particular, I did a family medicine rotation in Ontario. So it kind of helped me realize that this is really where I want to be and what I want to do. I also specifically found that I learned a lot doing internal medicine and emergency room rotations because they were very hands-on. So they let me learn how to do things. So I learned how to do suturing. I could do IV insertions, Foley catheter insertions, and EKGs. So like all the basic things that a doctor really needs to know in order to practice.
Okay, and what are some of the key things that stand out about UMHS that you still remember, things that set UMHS apart from other medical schools?
Yeah, I found UMHS to be very helpful to its students during basic sciences. So most of the professors there are just there to teach. So they're always available to you. If you're having trouble with any of your courses, you could go ahead and go to their office, talk to them, ask some questions. There was also the teaching assistants. They were very useful. So I found that very helpful. I also liked our school campus a lot. There was just no shortage of space, right? So we had the areas in the library to study. There was the study rooms that you could sign out. There was even the beds, the hospital beds for practicing exams. There was just no shortage of space for studying, and it was very useful. I also enjoyed the sense of community amongst all the students. So I found that even if we weren't just studying together outside of school, we would spend time together on St. Kitts, and we would explore, go to the beaches, have dinners, and just explore the island. And it was really, really a great experience. I also found it pretty easy to obtain rotations that were outside the regularly available rotations through UMHS. So for example, the family medicine rotation that I did do in Ontario was through the University of Toronto's lottery system. And once I was able to obtain that rotation on my own, it was easily added to my schedule and I was able to integrate that into my rotations.